Laura Taylor is a 35-year-old female who comes into the office with the chief complaint of establishing prenatal care since moving from Ohio, with no prior prenatal provider. 3 previous pregnancies with 0 births, 1 previous abortion, and 1 miscarriage, currently 20 weeks pregnant. Reports of regular menstrual cycles, with her last menstrual period around 5 months ago. Ms. Taylor has been taking oral contraceptives since the age of 18 and discontinued them at the age of 30. She's in a monogamous heterosexual relationship with her husband of 3 months. No vaginal discharge, no previous STI or mammograms. Her last pap smear was done when pregnancy was confirmed. All immunizations are up to date. She is not currently taking any prescribed medications or supplements, only reports taking prenatal vitamins. Ms. Taylor has no known medication or food allergies, although she does have a latex allergy which causes pruritus and erythema. There are no major illnesses or diseases to speak of in her past medical history. The only surgery she has had is a DNC. Her father passed away at the age of 60. He had coronary artery disease. Her mother is alive and well and has type 2 diabetes. Reports being a 1-pack-a-day smoker, but quit since becoming pregnant. Denies any current alcohol or recreational drug use. Previous marijuana user in her 20s. There are no reports of any safety concerns at home. She reports a recent 12-pound weight gain and an increased fatigue. Has noticed an increase in swelling in her lower extremities times 2 weeks, which gets worse at night. Complaints of nausea, heartburn, and constipation earlier on during this pregnancy. Reports increased urinary frequencies since becoming pregnant. Complaints of 5 out of 10 back pain after a long day of work, and is relieved by sitting in a chair. Increased size in breasts, darkened bilateral areolas, no complaints of syncope or weakness, no changes in thirst or appetite. Reports feeling anxious about taking care of a baby, sleep disturbance secondary to increased urinary frequency, no suicidal ideations. Ms. Taylor is a 5'1", 140-pound female with a BMI of 28.7. Healthy appearing, visibly pregnant, well-nourished, adult female in no acute distress. She's alert and oriented ×4, answers all questions appropriately with appropriate affect. Trace bilateral lower extremity edema, no linea nigra striae albicans noted. Breasts are free of mass or tenderness, darkened bilateral areolas noted. Fundus is at the height of the umbilicus, fetal heart rate is 140 beats per minute. The primary diagnosis for Ms. Taylor is pregnancy, 2nd trimester. She does not complain of sore breasts such as seen in the 1st trimester. There are no further complaints of nausea or mood swings, and reports of morning sickness in the earlier stages of her pregnancy, as seen in 1st trimester of pregnancy. There is a reported improvement in her energy level, and her appetite is improving. Her complaints of backaches are due to her increased pregnancy weight. Complaints of heartburn and constipation, often seen in 2nd trimester of pregnancy, is present. Again, uterine fundus is felt at the level of the umbilicus. We can rule out her being in her 3rd trimester of pregnancy due to the lack of Braxton Hicks contractions. There are no reports of difficulty taking deep breaths due to increased abdominal size. The current size of the fetus is not causing hypotension since her blood pressure is normal on exam. No striae albicans noted on abdomen, breast, thighs, or buttocks. There are no reports of colostrum leaking from her nipples. Although Ms. Taylor complains of back pain, there are no reports of or signs of vaginal bleeding, abdominal pain, uterine tenderness, or frequent uterine contractions. She also does not report any history of fall or trauma to the abdomen. There is also no prior history of placental abruption, which is a risk factor for future placental abruption. For medications, I would prescribe parodoxine 10 milligrams PO, TID PRN for nausea. Do not exceed 10 milligrams daily. Also acetaminophen 325 milligram tablet, PO Q6 PRN for moderate back pain. Do not exceed 10 tablets in 24 hours. I would order CBC, CMP, ABO grouping with HRO typing, a lipid panel, and a beta HCG. I would encourage healthy eating and also recommend eating smaller meals during the day and avoid greasy, spicy food. Recommend staying active with light to moderate yoga and some meditation. Recommend follow-up with a new referred OBGYN and come to the office post-delivery after 6 months. Thank you.